Dr. Emanuel, what do you say to this situation? Should the fines have been bigger? I mean, I'm seeing that the average fine is $1,000, but some of these premiums are $5,000 or $6,000 a year.
Let's back up to the Aetna case. I mean, it's very hard to know what the truth is of the Aetna case. In February and then again in April, you had the CEO, Mark Bertolini, saying, look, we've got 1 million people. He specifically said that he thought that going into the exchanges was a good investment. And then in May, you had one of the Aetna spokesmen saying we have no plans to withdraw from our markets. As a matter of fact, we might expand to New Jersey and Indiana. Now, maybe then they were trying to butter up the Department of Justice to approve their merger with Humana. Now, when the government has opposed the merger, they are saying, well, you know, we've got such losses, it's not such a good investment. It's very hard to know what the truth is. It's also very hard for us on the outside.
So are you saying that, you're saying that actually it's not true that these $200 million in losses that they're talking about are not true, that in fact this is perhaps politically motivated because they're angry at the DOJ for not allowing the merger?
Again, I think we simply don't know. And remember, there are lots of...
Do you deny adverse selection? That's what, first off. So, is that happening?
No, we do know that the pool coming into the exchanges in general has been sicker than the government expected. And I think Brian pointed out correctly that the number of enrollees has been less. I think there have been several reasons for that. One is obviously the initial bad publicity around the rollout. A second is, I think, that the website wasn't as good as it should have been. And the third thing is we haven't had the penalties kicking in yet. So as pointed out, people haven't really, until this year, begun experiencing the penalties. And the government, I don't think, has hasn't adequately made clear to people that they will pay a big penalty if they don't go in.
When we get the data from the Centers for Medicare and Medicaid saying that the per month cost per patient has remained the same from 2015 and 2014, essentially meaning that the pool has remained as sick as it was in the beginning. And we also have United Health, and we also have Humana saying that we're going to scale back as well. Why is it so hard to believe Aetna's case in pulling out of 11 states?
Yeah, I think that's a really good point.
This has to be a long-term investment for people. You've got to educate people who haven't had insurance.
But why does that have to be a long-term investment for a publicly traded company?
And I do think the government needs to do a better job of explaining to people the nature of the subsidies and make it much clearer to people that there is a serious penalty coming in if they don't get it. I think that as a part of an advertising campaign is going to be critical. I do think we need to improve the pool. There are still millions, tens of millions of people who haven't been insured, who are eligible, who need to be insured. And that is partially a marketing campaign, partially a campaign of showing people how much it actually costs, not the sticker price that they're